Good morning, everyone. My name is Alfred. This is again Alfred from LGBT Univers. Before we start, may I ask you to, or may I invite you to click on subscribe or follow me on TikTok as well with the channel. So this in particular, this series, we'll be talking about the NCLEX RN test taking strategies. With this, on this today, we will be talking about the strategy number 10, 11, and 12. Hopefully, I can finish this within 10 minutes. So, to begin, number 10, choose the least invasive choice first. So, one particular example for this one would be like, for example, treating a pediatric patient, right? For example, a 5-year-old, right? So when you approach a 5-year-old toddler, a 5-year-old preschooler, or a toddler even, well, obviously the child will be a little bit afraid of you because the child doesn't know you first. So introduce yourself, establish rapport. Maybe observe the breathing. That's where you could assess the respiration first, and then eventually go down to maybe praising or giving him praise of this choice of clothes, for example, his shoes, the color of his clothes, and then again go up by touching him, touching the patient, and maybe checking the pulse by touching his hand or shaking his hand, for that matter. So that would be strategy number 10. With number 11, never choose the answer that delays treatment. Right? And again, number 11, never choose the answer that delays treatment. Particularly with this multiple choice, this would be our multiple choice for today. The parent of a 12-year-old male child with a left below the knee cast calls the pediatric clinic nurse and tells the nurse, "My son's foot is cold and he told me it feels like his foot is asleep." So cold meaning hypothermia, right? And his foot is asleep meaning it's numb. In other words, it's numb, right? So which action should the nurse implement first? So when it's numb, that means there's poor circulation. That means it sounds like the patient is developing compartment syndrome. And compartment syndrome is a painful buildup of pressure around the muscles. And if it's acute, it's a medical emergency that happens with severe injuries or a surgery complication. With this one, it's probably, because it's a cat, it's probably a fracture, right? And chronic compartment syndrome happens when one exercises too hard or too often. Now, what are the symptoms of compartment syndromes, right? The 5 P's, as we call it: pain, pallor or pain, pale skin tone, paresthesia or numbness feeling, as this is expressed by the mother when it says the foot is asleep, right? Pulselessness or faint pulse, and paralysis, which is kind of a late sign, weakness with movements. So with this particular situation, number 1, prepare to bifurcate. Bifurcate meaning split in two or cut the left below the knee cast. Now, we all know that nurses is not allowed to do this, only the orthopedic surgeons. So obviously this is not an option for us to do. Number 2, tell the parent to bring the child to the office. Now, obviously, this one and the number 4 option, notify the child's orthopedist of the situation, will take time. It's time consuming, and we need to do something. The nurse needs to do something that will help the coldness or the compartment syndrome symptoms, right? So the perfect answer for this one would be instructing the parents to elevate the left leg on 2 pillows. Excuse me. So obviously with compartment syndrome, there's swelling. There will be swelling. So elevation of the left leg will decrease the swelling. This is a very basic knowledge, right? As well as another distracting option would be right leg on 2 pillows, right? And we're talking about, going back to the question, it says left. So the left leg should be treated, not the right? So it should be the left leg, and if it was right, then it should be right. right? So going going forward, excuse me, moving forward, let's do number 12. Assess the client first before implementing treatment. As we all know, the nursing process starts with assessment. You mean assessing the problem, diagnosis, planning, implementation, or nursing intervention, as well as the last one, which is the evaluation. Evaluation if the nursing implementation was effective, right? So going forward, this would be our multiple choice for this particular strategy. The nurse hung the wrong intravenous antibiotic for the post-op client. Which intervention should the nurse implement first? Obviously, assess. We should assess if there's any reaction to the antibiotic that that the patient was given, and the other options can be done eventually. If but the primary focus or priority with critical thinking would be number one, assessing if there's any adverse reactions. Then the other options would follow. That would mean administer the correct antibiotic medication, notify the client's healthcare provider, notify the doctor, complete the incident adverse occurrence report. How if you call the doctor, what are you gonna tell the doctor if you haven't assessed the patient? So you have to assess if there's any itchiness, shortness of breath, swelling in the area, hives, or anything like that would indicate that there's a allergic reaction to the antibiotic, right? So again, I would encourage you to follow me on TikTok as well as YouTube. You just type in LGBT Univers, Alfred Lai, that's Lai, and to be updated with new videos like this. Anyway, have a nice day and good luck.